Hi, this is Philip Ador, founder of NCLEX RN 45-Day Challenge. In this video, I'm going to be talking about anemia. Anemia can be rigorously defined as a reduced absolute number of circulating red blood cells. In practice, a low hemoglobin concentrations or a low hematocrit is most widely accepted definitions of anemia. So anemia can be defined as hemoglobin level of less than 120 grams per liter in females and less than 140 grams per liter in males. Red blood cells also contain many types of enzymes, including lactate dehydrogenase. Red blood cells are important in carrying oxygen and carbon dioxide, as well as maintaining the pH of the blood. Red blood cells arise from the myeloid progenitor cells in the bone marrow. Erythropoiesis is a process of erythrocyte production. Myeloid progenesis cells become reticulocytes first, and this path is stimulated by hormones including erythropoietin. Erythropoietin is a true endocrine hormone produced in the kidney by cells that sense adequacy of tissue oxygenation. Relative to individual metabolic activity, other hormones that facilitate in the red blood cell productions are the thyroid hormones and androgen. Reticular sites are the premature erythrocytes, so the premature red blood cells, a cell still capable of limited amount of hemoglobin and protein synthesis. The reticular sites enter the bloodstream 3 days later and matures to become the red blood cells as we know it. The mature red blood cells circulates for around 120 days, after which the time it is removed from the circulation. The reticular endothelial system includes the spleen and liver, where macrophages and monocytes will eat up and clear up these old red blood cells, or also clear up the abnormal red blood cells when performing it. Looking at hemoglobin is the first step to diagnosing anemia. But how does one categorize anemia? Well, one way is to look at the full blood count first and look at the mean corpuscular volume. The mean corpuscular volume, abbreviated MCV, is the average size of the person's red blood cell. Therefore, one way to categorize anemia is using the mean corpuscular volume. You can have microcytic anemia less than 80 femtoliters. Normocytic anemia between 80 to 120 liters, and then macrocytic anemia, which is greater than 100 femtoliters. And these are essentially the sizes of the red blood cells. Causes of microcytic anemia include iron deficiency, chronic inflammatory diseases, and thalassemia. Investigations that should be performed in this context include iron studies, and then calculating the Menser index, which is helpful in differentiating iron deficiency anemia from beta-thalassemia. When someone with anemia has a normal MCV, a reticular site count should be performed. Remember that the reticular sites are the premature red blood cells that are still in the bone marrow. The reticular site count can be either higher or it can be lower. If it's a high reticulocyte count, this can mean a hemolytic anemia or a blood loss, because the body is trying to compensate and produce more reticulocytes to replenish the red blood cells that are lost. If the reticular site count are low, this could signify a bone marrow disorder such as aplastic anemia, because the bone marrow is unable to produce adequate amounts of red blood cells. When the hemoglobin is low, the MCV is high. This signifies macrocytic anemia. A blood film should be performed to differentiate between the megaloblastic or non-megaloblastic macrocytic anemia. Megaloblastic anemia is basically where on the blood film you can see large immature red blood cells called megaloblasts. Also, you can potentially see the hypersegmented neutrophils. These findings on the blood film signify someone that has vitamin B12 deficiency. Folate deficiency or drug toxicity, side effects from methotrexate, for example. If the blood film only shows a large mature red blood cells, this is a non-megaloblastic and can signify alcohol abuse, hypothyroidism, and pregnancy as a potential cause of anemia. Anemia can be categorized based on the using the mean corpuscular volume, as we have talked. About another way to categorize anemia is by the mechanisms of anemia. We can easily categorize anemia in the way by looking at the red blood cell life cycle. If cause of anemia can be from a decreased production, so reduced erythropoiesis. Examples include bone marrow disorders such as aplastic anemia. Because remember, red blood cells are formed from the bone marrow. Chronic kidney disease can also cause anemia. Because when you have a chronic kidney disease or kidney failure, you're reducing erythropoietic production and therefore reducing erythropoiesis. Hypothyroidism, because remember, thyroid hormones play a role in stimulating erythropoiesis. Vitamin B12 deficiency and iron deficiency can also lead to anemia, because these are the substances needed in order to produce a good functioning red blood cells. Chronic inflammatory disease, which is basically caused a form of iron deficiency, but also is thought to reduce the lifespan of the red blood cell. Another mechanism which leads to anemia is through blood loss, and this can be gastrointestinal blood loss. Someone going through a heavy periods, trauma, accidents, motor vehicle accidents, for example, leading to blood loss. Another mechanisms leading to anemia is through the increase in red blood cell destruction. Increased destructions of red blood cells really means hemolysis. And this can be further divided into intravascular hemolysis, which means destruction of the red blood cells in their vasculature, and the extravascular hemolysis, which means destructions of the red blood cells outside the vasculature, typically in the reticular endothelial systems we talked about. Examples of intravascular hemolysis include disseminated intravascular coagulopathy, thrombocytopenic purpura, hemolytic uremic syndrome, and mechanical heart valve, where the red blood cells die through from the shear stress of the mechanical valve in the heart. Extravascular chemosis occurs when there is an increased destruction of the red blood cells, typically through the reticular endothelial system. Examples include hyperplanism, inherited hemolytic anemia, disorders such as sickle cell anemia, and hereditary spherocytosis, acquired from hemolytic anemia such as malaria. When a red blood cell gets destroyed, they release a number of things, which are important things to measure to see whether someone has hemolytic anemia. Red blood cell destructions causes the release of the lactate dehydrogenase. Red blood cells is made up of a lot of hemoglobin, millions of hemoglobin molecules. When hemoglobin is broken down, you get globin, which is a protein, and conjugated bilirubin and iron. Usually, the body is able to clear all these byproducts of red blood cells destructions. However, in hemolysis, you have overwhelming red blood cell destructions. And as a result, you can also have the free hemoglobin in circulation. Luckily, there are molecules which float around the body which help clear up these free hemoglobin molecules. These are called the haptoglobins. Therefore, blood tests to order in someone with suspected hemolytic anemia include measuring the lactic dehydrogenase, which should be elevated, the reticular site count, which should be elevated because the body is trying to compensate by producing more red blood cells. There should be an increase in bilirubin, which also means that the person can present with jaundice. And finally, low haptoglobin levels, because they are bound to free hemoglobin and are being declared up by the body. Red blood cells, as mentioned, are very important in carrying oxygen in the body, providing energy for the cells. And therefore, with low amounts of the red blood cells, you can have signs of basically fatigue and low energy. Persons with anemia can therefore present with pallor, conjunctival pallor, fatigue, sclera icterus if you are thinking of the hemolysis, bony tenderness if you are thinking of bone marrow disorders, lymph adenopathy if you are thinking of infections or malignancy, dyspnea and hepatomegasplenomegaly if you're thinking of hemolysis or bone marrow disease.